Hello, everybody, and welcome to tonight's parent workshop for the Farmington Community Library. My name is Joanne Robel. I am the Public Health Nutrition Supervisor at the Oakland County Health Division. I'm a registered dietitian, and I am also a lactation consultant. Today's presentation is going to focus on nutrition. The topic is Nourishing Beginnings, Nutrition for Infants and Toddlers. So the objectives of tonight's presentation is for the audience to gain confidence in the recommendations and guidelines for infant and toddler nutrition, to learn about tools, tips, and resources to aid in your child's nutritional intake, and then also to learn about services that are available in the community to answer any further questions in regards to maternal and child nutrition. So we're going to start the presentation off talking about infants. So the first topic that I always like to discuss is hunger and fullness cues for infants. This is one of the first ways that our infants and children are communicating with us for what their needs are. Sometimes hunger cues and fullness cues or satiety cues can be very hard to see. And it takes time to learn exactly what those cues are. So on this slide, I have a really nice table that goes over what typical hunger and satiety cues are for each age group. So typically with infants, a lot of times people think that when a baby is crying, that means they're hungry. And that could be so, but we would classify that as such a late hunger cue. Usually we want to start feeding baby when we start to see those lips start, what I say, smacking, looking around, rooting, putting their hands to their mouth. That's typically when we want to start the feed. And then usually for little bitty babies, when they start turning their head away or they just don't seem interested in the bottle anymore, that's when we know that they're full. And again, the cues do change through the time. So you can see between 4 and 7 months, the cues will change. And then 8 to 12 months, they're a lot more communicative than they are early on. Another topic I'd like to discuss is responsive feeding. And a really good quote from this is, "You provide, your child decides." And it really helps develop those healthy eating habits early on because you're responding to their feeding cues and not necessarily a schedule. They're more in tune with their own bodies, and it helps lower the risk of becoming overweight because they're truly responding to their hunger cues rather than just feeding on demand or feeding for some other reason. They learn how to feed themselves a lot faster. It makes meal times a lot easier because, again, it's meeting them where they're at and when they're hungry to eat. And it also creates a bonding experience with your child as well. So breastfeeding. The recommendations from the American Academy of Pediatrics do state that exclusive breastfeeding for 6 months. And then after that, typically around the 6-month mark, you'll start introducing foods alongside breastfeeding. And to continue breastfeeding up to 2 years of age, or usually what I say is when it's mutually desired. With breastfeeding, any amount is beneficial. So even if it's for a few days, a few months, or to the 2-year mark, it's still super nutritious and fantastic for that child. Unfortunately, the rates for breastfeeding are quite low. So in the United States, on average, the initiation rate, so what that means is the rate that women or individuals choose to breastfeed is typically at 84%. But in time, it drops off and comes out to about 47% of mothers who continue to breastfeed exclusively by the time the child is 3 months, and then drops down to about 25% at 6 months. And there's multiple reasons for this. Typically what we see in our practice, it's either a lack of knowledge, no support, or sometimes I always say there's systems in place where sometimes it's hard if we have work or school or other responsibilities. It's not always available to us. There's lots of great benefits with breastfeeding. there's benefits for the baby individually as well as for the mom. So for the baby, it is very easily digested, has all the right ingredients, and it does have special antibodies. And the benefits of for mom, it reduces the risk of excessive bleeding. And it also can reduce risk of many diseases such as hypertension, diabetes, and some forms of cancer as well. So at the end of the day, I always say fed is best, regardless if you're breastfeeding or formula feeding, as long as that baby is being fed, they're growing and they're thriving. That's fantastic. And that's what our responsibility is as parents. So I did put some directions for formula and how to prepare powdered formula. So usually powdered formula is the most common form of it. There is also ready to feed in a liquid form as well. And I won't go into the details with it. I usually say always read the can of formula that you're using because there are different brands that have different directions for how to prepare the formula. Also, too, it's really important that if it's not just you preparing the formula and there's somebody else in the family or a daycare situation, make sure that they know how to properly prepare the formula as well. On this slide, I also have formula safety and storage guidelines. So just really quick, usually what we say is once the formula is prepared, you have 1 hour to the start of the feed to finish that bottle, or 2 hours from the start of the preparation to start using that bottle for that feed. You are able to refrigerate prepared formula. So again, if it's under that 2-hour mark, you can put it in the fridge and use it within 24 hours. Also, bolded there, do not refrigerate. If a baby has already started to consume the bottle and there's like an ounce left, unfortunately, it's just not safe to refrigerate to save for later, just because we can see bacterial growth in that bottle, and it's just not healthy for a baby to have at that point. Also, do not put your baby to bed with a bottle. And then also do not force your baby to finish that bottle as well. Again, we really want to honor their hunger and satiety cues with that. So typically, the only thing that children or infants need for the first 6 months is just breast milk or formula. Water does not need to be introduced to a baby until 6 months or after. The reason why is because water, while it's great in hydrating, it doesn't have any calories, protein, fats, any real nutrients. And because babies' tummies are so small, it can kind of dilute and fill them up a lot faster. It can cause slow weight gain, overhydration. There's a lot of negative effects that could happen. So we really suggest holding off on water until 6 months. And then at that time, between 6 to 12 months of age, typically it's recommended to have 4 to 6 ounces per day. And typically what that looks like, it's just sips out of a sippy cup throughout the whole day. It's really hard for a child that young to sit down and drink a full 4 to 6 ounces at one time. So when you are transitioning your child to drink water, we typically encourage that also to be the time that a sippy cup is introduced. So rather than offering the water in a bottle, we do want to transition them to the sippy cup just because it's a different oral motor context for them to get used to and develop. So on this slide, I have some pictures of some sippy cups that we recommend. And sometimes it's just truly figuring out what works best for your child. I do like to point out that all the sippy cups, so there's a straw cup, the 360 cup, an open cup, and then the blue sippy cup has a hard top on it. We really don't like what we call transition sippy cups, or the sippy cups that have like a rubber nipple or a soft nipple on top, just because the oral mechanics of using it are very similar to a bottle. And again, we're training the baby to use something other than a bottle at that time. And truly, they really don't need a transition cup. They can just go from one to another. It does take time. Again, it's a new skill that they're learning, so you just have to be patient with it. and just water in the sippy cup. So you don't need to switch formula or breast milk into the sippy cup at this point. Also too, there are some points as far as benefits of using a sippy cup. So we see less child obesity, less cavities or baby bottle tooth decay. Also too, the longer you wait, the harder it is to transition that baby. On this slide, I have some benefits of sippy cups. So again, it helps develop and strengthen motor muscles for speech. It reduces the risk of infection. And the reason why is typically when a child or a baby is drinking out of a bottle and they're reclined and lying back, they can have some spit up or some formula can dribble out of their mouth and it goes to their ears. And then it can pull up in the ear canal and cause ear infection. So we do see that quite frequently. Whereas a sippy cup, they're having to sit upright. So that's not typically a risk that we see. It also promotes better tooth development. I'm sure that you've heard, and I think I'll touch on this later in this presentation about bottle tooth decay. We really want to prevent that, and the best way to do so is by incorporating the sippy cup. And also too, it helps strengthen hand and eye coordination. Again, it's not just, there's a lot of developmental benefits to transitioning that child at that point. So I have some tips. There's so many different tips. Every child reacts differently to the transition to a sippy cup. Some are totally fine with it. Some, it just takes forever and you try 100 different sippy cups and they still refuse it. So different ways to do it. So again, you can start off by offering water. They say, if the child doesn't like the taste of water, you could try introducing like some of the formula or breast milk in the cup instead. Starting a routine to help the baby know that like this is the sippy cup time. Slowly removing the bottles and transitioning the sippy cups out. Usually removing the daytime bottles are easiest. That nighttime bottle is usually the hardest to let go. Being patient, being consistent, and then always making sure that everybody in the house and all the caregivers are aligned with your goals to use the sippy cup and help transition that baby off the bottle. And typically we see the full bottle transition, we recommend at 12 months. And also keep bottles out of sight. So again, it's one of those out of sight, out of mind. If the baby is constantly seeing the bottle, they're going to ask for the bottle because it's comfort for them. It's all they know. And it truly is a lot easier for them to get the fluids out of the bottle than a sippy cup. They don't have to work as hard. So again, selecting the perfect cup. These are some really good tips that parents have told me and that I've used myself personally. Sometimes just making it fun. So having your child's favorite cartoon character or color, they'll be more interested in it. Again, trying out different types of cups, finding one that's easy to clean is really important, especially those straw cups. They can be really difficult. And that's another reason why I typically just encourage water because it's really hard to clean milk out of a straw sippy cup because the straws are just so small. Also too, don't be discouraged if your baby doesn't show an interest in the cup. It does just take time, sometimes just keeping it around them, keeping it, again, having it consistently be at meal times or while they play. The more they're exposed to it, the more often and more opportunities they have to try using it. So in addition to starting sippy cups around 6 months, it's also the time that we typically encourage starting solids. And I usually say readiness cues are important. So again, 6 months is an average of when babies are ready. But every baby is different. Some babies are ready slightly earlier. I think the earliest I've ever seen a child meet all these readiness cues was 5 months, and that's very rare. And some babies, it's closer to the, end of 6 months going towards 7 months. So the cues that really tell us when a baby's ready to eat is that they have good head control. They can hold their head up. It's not wobbling around. It's not like a bobblehead. They start to open their mouth when they see food come. And you'll see, like, if you're eating in front of them, they're just staring you down and they just want to reach towards the food, take the food out. They're getting really excited. They start to like jump around and get all bouncy when they see food come. Also, too, when you do introduce the food on the spoon, that they're able to lick the food off, take it in their mouth. Sometimes you might notice that a child will do that and then they start kind of spitting out the food and their tongue is moving it forward. So we call that a tongue thrust. And basically, what it is, it's just like an evolutionary protection that tells us that the baby's not ready yet, prevents them from choking. So it does go away again at that 6-month mark, typically. Also, too, another tip is that we like to see that they've doubled their birth weight, which again typically happens at 6 months. Another thing too that now I'm looking at it, I don't think it's quite on here, but we do want to make sure that they're able to sit somewhat independently. Usually it's closer to 7 months where you can, even sometimes 8 months, where they can truly be sitting on their own without anything surrounding them and without you being nervous. We just want to make sure that they have enough core and like back strength to sit up straight in that high chair. You're probably still going to have to use straps because they do get tired and they will start to lean forward. But ideally, we want them to be sitting straight up. So some recommendations for starting solids. I won't go over all of these. These are a lot of recommendations. I just wanted to be on this slide so you can have to peruse on your own. So typically, most infants will start off with pureed foods and then they transition to finger foods. We usually see this between 7 and 9 months. I'd say on average, 9 months is really when most parents really start incorporating the finger foods. And this is when you really start to see the baby sit up more independently. Again, you're not seeing that slouching and leaning forward. They're bringing objects to their mouth. They're picking up objects and putting them in their mouth, whether it be toys, or some food pieces. And that's really important because that's a huge developmental skill that we like to see. So on this slide, I have some pictures of some sizes of what we would consider a finger food. They're all very soft. They're all kind of cut up decently small. The way that I always like to say is that if you were to take your 2 fingers and take the food and like mash it between your fingers, it's soft enough where, you'd be able to mash it. Sometimes parents get nervous about that, that they don't have teeth yet, or they only have like 1 or 2 teeth, and how are they ready to do this? But I'm sure any parent who's ever, put their finger near their baby's mouth and had them clamp down on it can say that those gums are extremely strong. So you do not have to worry about that. Another thing to be mindful around this time is choking hazards. So again, as you can see on the previous slide, everything is kind of mashed. It's kind of an irregular shape. Nothing is like really round or like in a shape that would be dangerous. So there is ways to modify foods that we would consider choking hazards. You don't have to necessarily, do without a lot of the foods. So a lot of the smaller pieces, so like grapes, cherry tomatoes, you just want to cut those up, and you can see that picture on the slide that just shows cutting it into fourths. I've had parents tell me with grapes that they've peeled the grapes. You do not have to peel the skin off the grapes. They're not going to choke on that. Again, all you have to do is quarter it. Also, too, with tube-shaped foods, that can also be a choking hazard because if they bite on it, it can create more of that rounded shape. So the best way to prevent that is cutting it in long strips. So like a hot dog, string cheese, you just cut it lengthways and it helps with that. Some other things too is you don't want that child to really be standing up, walking around, being distracted. They need to be sitting in their environment, just to prevent that. Okay, so foods and drinks to avoid when starting solids. So on here, I have a list. I won't go into each in detail, but if anyone has questions at the end, we can go over it. And I'm sure a lot of times I feel like pediatrician offices will go over all these as well. Food allergies. So this is something that a lot of parents get concerned when they're starting foods is, does my child have a food? So there is a list of 9 foods on this slide, and these are the most common food allergens that we do tend to see. Um, it would most likely be present pretty early on. And basically, what a food allergy is just your immune system thinks it's something harmful and ends up attacking its own body. These are symptoms of food allergies. And typically, one thing too, I always like to make note of is most of the time, food allergies, if you have a symptom, it comes on quite fast within probably an hour. So if you gave, let's say, peanut butter for the first time and like the next day that child had really bad diarrhea, it's probably not associated with it. And also, too, most of the time it's 2 symptoms that occur together. So vomiting, diarrhea, that's kind of things that like a lot of things can cause. So I wouldn't really be too concerned unless it was paired with something that would be a very prominent allergy symptom, such as swelling, tingling or itching of the mouth, hives that break out over the body. That's more common. In food allergies, truly, we really don't see many children that have very drastic or severe food allergies. So it's not something I know a lot of parents are scared of, but rest assured that very few will have like an anaphylactic reaction from any of these foods. So again, there's some pictures of what you might see. So the hives are really common. And again, hives are not just around the face, they are all over the body. So on the slide, it says like citrus fruits, tomatoes. A lot of times parents will give those and the child has a lot of redness around their cheeks, their lips, and their hands. That is more so because of the acid in those foods and not a reaction. And it does go away typically after a few hours. And again, it's just because the baby's skin is so extremely sensitive. You don't have to avoid those foods. So the best way to know if the child has a food allergy is that when you're beginning to introduce, offer a new food. When every time you offer a new food, do it for 3 to 5 days and see how they react. If there's no reaction, most likely they're fine. Typically, children don't have a reaction to food the first time. It's the second or third time that you're introducing it. There's different ways to reduce the risk. So this is something actually that's changed quite dramatically in the last, I'd say, 10 years. Prior to, the recommendation was always wait on those food allergens. So like whether it be milk or eggs, peanut butter, pediatricians used to advise waiting until they were like over 1, 2, sometimes even 3 years old. And what we saw was a huge spike in food allergies developing in the United States. And they looked at other countries and saw that a lot of other countries didn't have any food allergies or very few food allergies. And the reason why was because they were introduced to those foods so early on. So that's typically the best way that we recommend it is, offering these foods starting at 6 months and going through all the common food allergens. So again, that list of 9 foods that was on one of the previous slides. You don't need to offer a large amount. So on here, it's half a tablespoon 3 times per week. Again, you don't have to avoid these foods during pregnancy or lactation unless, the mother has an allergy, then obviously she needs to avoid it for herself. And just giving a diverse diet is one of the best things you can do. For babies, obviously, with nuts, peanuts, and tree nuts, we do want to expose them to that around that 6-month mark as well. But you're not going to offer full nut to a baby. That would be a choking hazard. So usually the best way to do so is either in a nut butter or a powder form. And you can just mix it with like a cereal, like an oatmeal cereal is most of the time how it's done. So what to expect with feedings. So meal times. Meal times are messy and dirty. It is okay. That is how it should be. So the picture that you see, that's a normal feeding experience for a baby. So it's not clean at all. Also, we do want to start doing meal times to reflect meal patterns. So what we would consider breakfast, lunch, dinner, and snacks through the day. That routine is really important because babies thrive on routines. Always make sure that you clean your baby's hands prior to, because babies have everything in their hands and all sorts of germs and bacteria. And then they're going to put that food in their hands. So we want to make sure they're clean. If you are worried about a mess, just use a plastic mat. I just honestly, for my sons, I just always put like a towel on the floor, and it is what it is. You have to clean up, unfortunately, after, but it's beneficial for them. You want them to be safe. So we always recommend either a high chair or a booster, and to use the straps on that as well. And obviously stay in the room. I would never leave a baby under 12. I still don't leave my almost 3-year-old unattended eating, just in case anything were to happen. We want to have the baby present at the table, seeing the family members, engaging in that like family time dinner routine, limit distractions. So, avoid letting the TV on, phones, anything like that. Talk to your child as well. Finger, spoons, forks, all of that we want to expose them to as well. And again, family meals. This is a really important time to start developing those family meals and giving good, healthy options at each meal. As far as amount, just let the child decide how much they want to eat. Again, you decide what is prepared. The child decides how much they want to eat, and look out for those hunger and fullness cues. Okay, so a toddler. So now that we have the basics down on infants, we can move to the older age. So normal appetite and snacking. So I'm sure this is something most of you know who have toddlers, that they snack a lot. They ask for a lot of snacks. It is important. Snacks are an important part of the day, but we do want to make sure that we are trying to do as much of a meal pattern as we can. So again, scheduled meal times. It helps establish healthier eating habits. It helps them learn when their tummy is full, enjoying meals with the family. And they really truly, again, because children thrive on routines, they know what to expect the next meal. Normal intake. So this can range quite a bit sometimes, but usually a good rule of thumb, it's only a quarter of an adult. I know a lot of times the parents will look and say like, wow, my toddler ate absolutely nothing, just like a bite or two. But honestly, that's probably all that they need. So an example as far as how much a toddler does need to eat. So just an ounce, you see an ounce of meat, 2 to 3 tablespoons of beans, 1 to 2 tablespoons of vegetables, 1 to 2 tablespoons of fruit, quarter slice of bread. That is more than sufficient. If they ask for more, give them more. If they're fine with that, then don't push it. Again, we really want them to develop their own hunger and fullness feelings. Avoid force feedings. Always be patient with your child. So again, this is a new experience for them to be having all these foods. We want it to be an enjoyable experience. New foods take time. Sometimes we never ever want to, cause a negative connotation with the food with a child. So make it fun, offer the food many times, and you just have to be patient with it. Picky eaters. So, we do see this a lot. Typically the best way is, continue to expose them to the new foods as much as you can. If they're truly not eating like an entire food group, like they won't eat any fruits or vegetables, or they won't eat proteins, or they won't eat crunchy foods, or they won't eat something like that, keep an eye out for it. Let your pediatrician know, just to make sure that they're aware that the diet might be limited. And I could talk for hours and hours about picky eating. So I'll leave it at that. And if any other further questions with that are in the Q&A session, we'll go over it. So again, here are some additional tips for picky eating. I do always like to touch on juice because I do get quite a few questions on it. So we do want to avoid juices or any type of drink that has sugar added into it. A little bit of juice is fine here and there. I'm not a really big fan of making it routine. And also, if you do give juice, I always water it down. And there's two reasons for that. Number one is that the juice does have natural sugar, which does get stuck on the teeth, can cause cavities, and I see it all the time. And also too, they just have such a preference. Juice is so sweet, and we don't want them necessarily to get used to having that sweetness because kids love it. It's important to read labels. Sometimes it's really hard to see, if it's a juice, or sometimes you think it's a juice and it's not a juice. So, if you are going to give your child a juice, always give something that's 100% fruit juice, and it should be labeled that. And again, I always check the labels just in case. So obviously juice, 100% fruit juice is going to have natural sugars in it. Again, a little bit of juice is fine. I personally would not give anything with added sugars as far as a beverage to a child, a toddler. So this just goes over how to read a food label for juice and what to make of that. Also, too, ingredients can be tricky because it doesn't always say sugar. Sugar can be called multiple things. So these are just a few different names for sugars. And I know I had said in the beginning that I was going to touch on tooth decay. So that's something that we see quite commonly with children. The main cause can be the sugary foods, drinks, especially like snacking all day, grazing throughout the day, not drinking water. Water helps kind of flush the mouth and keep it clean, not brushing teeth. And it's hard to brush a toddler's teeth. So, doing everything we can to prevent cavities is important. Again, I had said this in an earlier slide, not putting your baby to sleep with the bottle because it can cause a lot of tooth decay as well. And it's really, really difficult. I think this is something that parents do struggle with quite a bit. And it definitely takes time. But I think the earlier you can wean them off that baby bottle at night, the easier it is to do. So here are some tips on this slide of things you can do. Okay. And then lastly, I did want to touch on the maternal and child nutrition home visiting program. So this is a program that I supervise. So we are a team of 5 registered dietitians that go out in the community and conduct home visits with the maternal infant population. So we see women who are pregnant, we see infants up to 12 months, and then we do see older children, but they have to have like a chronic medical condition, like typically it'd be like cerebral palsy, like a tube feeding, something that wouldn't necessarily, like we wouldn't be able to take it for just like childhood obesity or picky eating or anything like that. I am going to stop sharing my screen really fast just to take you to the website to show you if that is something you're interested in. Let me just pop that up and then I'll reshare my screen. Okay, so this is your website. So again, it has a little information about what exactly it is that we do, eligibility. So again, we are focused on the maternal infant child population. The other caveat is that you have to be an Oakland County resident. We don't do visits out of county. If you're interested in applying, you can refer yourself. You just click the online nutrition services referral form. There's no costs associated with it. We don't charge insurance. It's just a program that's run out of the health division. Also too on here, I always like to go over our provider toolkit. So I think this is great. These are handouts that we've either found on appropriate websites like the USDA or the CDC or the American Academy of Pediatrics. Also, in addition to that, handouts that we've developed ourselves. So if you go here, like if you had questions on infants, so these are some really good websites on infant nutrition that we recommend. And then we have all our client education material that's completely free. And most things are translated in both English and Spanish, but just super helpful things. So like here, we have a handout on bottle weaning. And that just takes you to this great handout that we've developed that just talks about tips and tricks. And again, just different types of sippy cups that you can use for your child. And then we also have a toddler section, school age, teens, healthy beverage, and then some additional handouts as well. And then I am going to stop sharing and then pull up my PowerPoint one more time. Okay, and then lastly, I just wanted to share my contact information. So again, our website, which I forgot to mention in the previous slide, is at oakgov.com/nutrition services. Again, you'll find the referral form on there as well as the provider toolkit. And then I have my email address and my phone number. So if you have any questions, feel free to contact me through either my email or phone, whatever you're comfortable with. My references. And thank you. Thank you so much for attending today's workshop.